Hey, Dr. Wagner here with Patient Mastery. In this quick video, I'm going to show you a new way to look at your recommendations conversation so your new patients are far more likely to feel good and inspired about investing in care with you, regardless of what your recommendations are, regardless of what your fees are, whether you're cash, insurance, a mix, it doesn't matter, because when you hear the proverbial ROF in chiropractic, if you're anything like me, it causes some stomach turning, it causes some hesitation, because I was taught the 45-minute to hour-long report of finding, spouse had to be there, didn't want to be there, recommending a ton of visits, an incredible amount of time, more, to justify a high investment, and saying a lot that I didn't believe in, completely scripted, and it just made my stomach turn. So if thinking about giving recommendations or doing an ROF, which I don't like using that term, but that's how most chiropractors relate to it, doesn't make you feel excited to give the patients an opportunity, this video is for you. So remember, whatever you feel internally in any interaction with patients is what they feel. So if you feel hesitant or uncertain about what you're saying or recommending, they're going to feel hesitant and uncertain about you and about what you're recommending. So what do you think the conversion rates are going to be there? What do you think the referral rates are going to be? What are the retention rates? But if you feel certain and inspired about what you're recommending, patients are going to feel more certain and inspired about you and your recommendations. So I teach a 5-minute recommendations conversation, both in the online program and at Patient Mastery Live trainings. Really, really simple. Simple to walk into that room and give it, simple for patients to hear it and receive it and say yes, even if they thought insurance was going to cover, and then it turns out either you don't accept the insurance, they have a $5,000, $10,000 deductible, and they're going to be all out of pocket. It just makes it simple. No salesy, no aggressive, no bait and switch, none of that craziness. And unfortunately, is so common in our profession and causes patients to have a level of skepticism that they don't have with the PT, they don't have with the orthopedist, they don't have with the acupuncturist, but they do have with you because of who came before you and what other people teach in the profession, which hurts your credibility and your professionalism, even if you don't do it. So I'm here to change that. So the main concept for this video, which if you just anchor to this and have it up here and use it in every recommendations conversation you give, will make a night and day difference. And that's understanding what patients are actually investing in with you. So when I say investing in, that's what they're buying, what they're paying for. It's the money component. Remember, money is very emotional. It's probably the most emotional topic in society. More than politics, more than religion, more than sex. People get finicky and emotional around money. So you want to bring your best self to this conversation. How do you do that? You start realizing what patients are actually using their money for. Now, as chiropractors, we're misinformed and mistaught, miscoached on what patients are buying. So they're not buying your care, which includes your number of visits, the amount of time your care is, whether it's a week or a year. They're not buying your technique. They're not buying your modalities. They're not buying your staff. They're not buying your time, whether it's how much time you spend in a visit or how much time you spend in the total amount of care with them. They're not buying any of those. You know what else they're not buying? However you see chiropractic, whether you are looking at it from a tissue layer, whether you're looking at it from a structural, biomechanical, whether you're looking at it from an intersegmental, subluxation, whether you're looking at it from a functional medicine standpoint, whether you're looking at it from tonal, it doesn't matter. They're not buying that either. Now, that doesn't mean that's not what you're delivering. That's not your intention to help their body heal and recover, but that's not what they're buying. So if that's the majority of what you're thinking, what you're writing down, or what you're explaining to them during your recommendations conversation, you're sabotaging yourself and you're sabotaging them from getting the care they need by becoming overwhelmed, confused, and you talking about something that they don't really get, understand, or most importantly, care about. So, what is the patient investing in and buying from you? Getting their life back. And I don't say that from a philosophical, spiritual, or grandiose standpoint. Literally, if you walk around all day with a pebble in your foot, how badly is your life affected? You're pissed off, you're frustrated, you're cranky, you're in pain, everything is compromised. That's a pebble in your shoe. Now imagine your typical patient coming in with headaches, a disc issue, sciatica, chronic pain, can't sleep, can't have their weekends, can't perform at their fullest at work, can't sleep through the night, irritable with their spouse, not doing what they love to do, their most important passions and hobbies. When you start showing people that that is what they are investing in, that through your care, this issue is going to get resolved, and that's what their life's going to look like, you will see an entirely different new patient who goes from, is this the care I need? Is this for me? To, can we start today? I want to do this investment, even though I thought insurance was going to cover. Switch it from all about you and chiropractic and whatever else you've been taught to sell, where the patient needs to buy, and you switch it to them getting their life back. Now, how do you know what getting their life back looks like? Well, you've got to ask the right questions in the consult. You've got to actually care. You've got to find out. You've got to write it down. You've got to remember it, and you've got to give it back to them. And when you do that in the perfect 6-question consult, in the 5-minute recommendations conversation, you will see more referrals, more patient startup, more pay in full, if that's even an option you want to give, more retention, and most importantly, you will feel great about going into the conversation. The patient will feel great about the conversation. If the patient's spouse is there and then they come back the next day for their own recommendations conversation because they felt inspired to get an exam with you, they won't feel like you just did a scripted robot timeshare sale on them, like most other ROFs I've ever seen feel like. You could actually go in inspired. I'm going to show this person what's possible for their life. I'm going to offer them to get their life back, and not from a place of righteousness or grandiosity. You're just facilitating their body to heal, as long as you believe you can help them. When you position your care as getting back what's most important in their life, watch how much easier getting the investment is, growing your practice, having a lot more fun, and being the most trusted, respected, sought after, and referred to doctor in your community. Try it on. You don't need to have the perfect words or script or even the 5-minute recommendations conversation that I teach to influence this into your recommendations. You could do that tomorrow. Focus on what matters to them more than what you think they need to understand, agree with, or get. Remember from a previous video, that is the biggest misconception in the field that has sabotaged chiropractors. Patients don't need to agree with or understand what you do to want it. So don't fall into that trap. Make it all about them and watch how much easier patients follow your recommendations and invest in you. I can't wait to hear how much of a difference this has made. If you want everything that I offer, make sure to get to an upcoming patient mastery training or the online program. Thanks for all you do.